Well, it seems like updates on COVID-19, the Delta variant, vaccines, masks, they are coming at us daily, even hourly. So we decided to get some help answering your questions. We turned to 11 Alive's medical correspondent, Dr. Sujatha Reddy, in today's Good Health. Dr. Reddy, I'm always so happy to talk to you. Talk about a lot of confusion right now. You know, as a parent, we're sending our children back to school, but of course we have the very contagious Delta variant out there. So what do parents need to know, first and foremost, to keep the kids safe?
Yeah, I think that's the million-dollar question everybody has because we know the best place for our kids is to be in person learning in
Yes.
school. So, but there are things we can do to help protect our children. One thing is you can create kind of a cushion of or a protection bubble around them by making sure everybody eligible for the vaccine in the family and in your circle of friends possibly is vaccinated. The more vaccinated people around the kids, the more protected they're going to be.
Well, now, doctor, I do want to get back to children and vaccinations because they can start getting vaccinated at age 12. Do you see any reason why parents shouldn't get their child vaccinated right when they turn 12, right when they can?
There's going to be a few kids who medically can't get the vaccine, but beyond that, there really is no good reason. And I have to say, I think we've seen a progression, and even my thought process has evolved with this pandemic. With the original coronavirus, children were very protected. It was rare to hear about a child getting serious symptoms from COVID. But now with this Delta, children are unfortunately vulnerable to this variant. So I think vaccination for children makes a lot of sense. So if you have any doubt about your child getting the vaccine, talking to your healthcare provider, your pediatrician is going to be the key.
Doctor, I was so surprised and still am by, so many friends of mine, family members, people that you are just randomly talking to that are still very hesitant about the vaccine. They point to the fact that there are still breakthrough cases. So what would you say to anyone who has that hesitancy about still at this point going out and getting vaccinated? Why is it something that you're really, really advocating?
Yeah, and I think that's the million-dollar question. So there's two things you asked. First was let's talk about breakthrough infections, right? The people that have been vaccinated, you're really protected against serious illness and death from coronavirus, even with the Delta. So if you get vaccinated, you may catch the virus, you may test positive, but your symptoms are typically going to be mild. But most importantly, if you get vaccinated, you're not going to end up in the hospital and you're not going to die of COVID. And we're seeing that Delta variant is a deadly variant. So if you're not vaccinated, you're vulnerable to serious infection, ending up in the hospital and dying. So that's the difference. As far as why people are still not getting vaccinated, it's a personal choice. I think if you were on the sidelines kind of waiting for a couple of things, one is the emergency use authorization was granted for the majority of the vaccines in December. The drug companies are now filed for official, real authorization, if you want to call it that, non-emergency, but regular authorization. And that should be coming out hopefully by September. And maybe that'll make some people feel more comfortable. We've given hundreds of millions of doses of coronavirus vaccine, and you've really not heard of any unforeseen complications or side effects. We know there can be side effects, but the majority of them are short-lived and self-limiting, meaning they go away by themselves in a few days. So the vaccine is incredibly safe. If you were waiting to see what was going to happen, I think now you can say we've got, 8 to 9 months of people that have been vaccinated and everyone's okay. Those myths that are out there are just myths.
Well, we've been hearing so much about this Delta variant that my question is, I got my daughter tested last week because she was going back to school and she was under the weather. So how are we tracking the Delta variant when she is just getting a random test? How is it being specifically identified as Delta?
Yeah, and that's a great question. So right now, if you get COVID or test positive, more than likely it is with the Delta variant. We think 80+% of all COVID cases now are caused by the variant. But when you
Okay.
go and get that rapid test, that just tells you yes or no, you have COVID, and that test can't tell you about Delta. If you go get the PCR, that also tells you, yes, you have COVID, no, you don't have COVID. But the PCR test, that same specimen, that virus that's tested positive, in some instances, the government, state labs, federal labs can take that virus and look at its entire genomic sequence, look at its DNA and its genes, and that's how they tell if it's the Delta variant.
Doctor, thank you so much for your time and for clarifying a lot of confusion out there. We so appreciate you.
Always good to see you, Christine.
Of course, you can always go to 11alive.com for the very latest on COVID. There's even a specific section to help answer your questions. Just click on COVID Data Verified at the top. Such good information.